Hey guys, welcome back. My name is Tony Maritato. I'm a licensed physical therapist, and today I'm answering another question from the Facebook group, Total Knee Replacement Support Group for Kind People. So the group member asked, my surgery is in 3 days. I'm so nervous about home recovery. How often do you need to walk and how far? How many times a day do you ice? Can you sit normally in a chair, or do you have to elevate the leg all day long? Thank you. Okay, those are great questions. I love beginner questions, people that haven't had the surgery yet. So let's hit these one at a time. How often do you need to get up and walk? And how far do you need to get up and walk? I'm going to tell you, as a therapist who's never had a knee replacement myself, full disclosure, but I've worked with hundreds of individuals who have had knee replacements. The general advice and what I try to recommend is, if possible, try to get up every 1 to 2 hours throughout the normal part of the day. You want to allow yourself the time to recover, the time to rest. I'm a big believer in the first 10 days post-op. We want to focus on recovery. The range of motion will come. But if we can get up, walking, moving around, and in terms of how far to walk, from the living room to the kitchen to the bathroom, I always say if you're drinking enough water, you're going to have to get up and use the bathroom every 1 to 2 hours anyway. So that is going to be your typical daily routine. Yes, there's an increased risk of blood clots. Yes, there's an increased risk of range of motion deficits and other stuff. If you find that you're sitting in a chair for 8 to 10 hours a day and then trying to sleep throughout the rest of the night. But the idea is, within reason, if there is a way that you could get yourself up and move around 10, 20 feet within the house every 1 to 2 hours, amazing. That would be outstanding. But if you're just exhausted, there's a lot of blood loss. There's other factors that come into play. If you're just exhausted, give yourself the time to rest. Give yourself the nap. Because I know most patients tell me they're not sleeping well at night. So they find that they have to make up some of that sleep during the day. Take it where you can get it. Okay, the next question was, how many times a day do you ice? So icing is always one of those topics that gets discussed a lot. There are some surgeons that are absolutely stringent on their icing program. There are other surgeons that say, you know what? If you don't like the way ice feels, don't worry about it. Some patients will even use heat on an acute post-op knee replacement. The clinical research would suggest ice or heat are both acceptable. It's going to be whatever feels best to you, whatever allows you to be more comfortable, to get up and to move around a little bit more, and to follow your surgeon's instructions. But ultimately, I've seen people use no ice or heat. I've seen people use the ice machines or cold packs, and I've seen people use a heating pad. All 3 cases, they've all done well. It really is just to make you more comfortable. But look at your surgeon's packet. I can almost guarantee your surgeon has set recommendations on icing for 10 minutes, icing for 20 minutes, take it off for this long. They're probably going to have that information ready for you. And then you were asking, can I sit normally in a chair? Do I need to elevate the leg all day? So it really depends on your swelling, truthfully. I've evaluated 3 or 4 post-op knee replacements this week in my clinic. I can tell you that one individual, we were about, don't quote me on this, about 10 days post-op. He was really struggling to get more than 30 degrees of flexion. He had some significant swelling in the leg. There was no chance that he was going to be able to sit with the leg resting on the ground comfortably. So his recommendation was more of the time to spend with the leg elevated and his body either reclined or flat to try and drain some of the fluid out of the lower extremity. I had other clients this week who were about 7 days post-op who were able to sit in a chair and allow the knee to flex to just about 90 degrees comfortably, feet on the floor. So if you're not experiencing any complications related to swelling and you're comfortable to sit in a recliner, in a chair, on a couch with your foot resting on the floor, that's totally fine. But if you find that your body is having a hard time, the swelling is increasing, the redness, the warmth around the knee, the post-surgical site is increasing, it would be advised to keep the leg elevated. And in an ideal world, the leg would be elevated, the ankle would be higher than the level of the heart, the body would be either reclined or flat, and we would be using gravity to assist to reduce some of that swelling. And then that's it. Those are your questions. So listen, you're in the Facebook group. You're hopefully watching this on YouTube. There's lots of you out there that have total knee replacements scheduled this month, next month, into the future. Absolutely feel free, ask your questions, post in the comments. If I can't get to them, hopefully somebody else on the YouTube channel or in the comments will share their experiences, because we are a community, and as such, I want everybody to be actively helping each other out. Thank you so much for watching. Subscribe to the channel, and I'll catch you on the next video.